Hello, everyone, and welcome to another episode of 2 Minute Emergency. So, before I get started, you will probably hear in the background a dog whining. I just want you to know that no dogs have been harmed during the filming of this segment. So, long story short, my husband was out running and found a puppy that was lost and starving. And so he brought it home and we tried to find its owners. But right now we're being foster parents to this puppy. No worries, if we don't find the parents, we do have a new family for him. But in the meantime, that's him because he does not like to be left alone. And so he is in the crate right now. So he requires a lot of attention. And if I have him running around underfoot, I really can't get much done. And I can't give you my undivided attention. So who am I? I am Dr. Leslie, your board certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these emergency tips twice a week, every Tuesday and Thursday, to help educate you about emergency conditions, keep you healthy and safe and out of the emergency department. So what is today's topic? Today's topic is something that most people wouldn't really think of as being an emergency, but yet it affects so many. So as you probably know, spring is almost here. Spring starts on Saturday. And with spring, we have seasonal allergies. Yes, those wonderful things that are a nuisance to all of us. So I want to speak to you a little bit about seasonal allergies because a lot of people do come to the emergency department because they're just so miserable with these. Symptoms of seasonal allergies include runny nose, itchy, watery eyes, nasal congestion. Sometimes the congestion is so bad that you feel the congestion in your ears. And what comes along with it for some people is also sinusitis. So we have several different sinuses, but the most common ones that people think about are the frontal sinuses here and the maxillary sinuses right here. And when they become congested or irritated, they make you miserable. Not only can they cause headaches, but also that feeling of pressure and just not a fun thing to have. And here in West Texas, pretty much everyone has chronic sinusitis. Plain and simple, because of our weather. And matter of fact, yesterday, the maximum wind velocity here right at my home was 30 miles an hour. And that is not with a storm. That is just wind blowing all of that dust. And you can imagine as spring comes around, all of those pollens, they're all trapped in that airflow and it hits people hard. So what are some of the things you can do about it? Well, there are plenty of over-the-counter medications that people try. Now, I've suffered with allergies to some degree my entire life. And I grew up in the time when you had a couple of options. Benadryl or diphenhydramine was the main one, but of course that made everybody sleepy. So you really couldn't function very well when you're taking it, especially as a child trying to manage in school and falling asleep by 10 o'clock in the morning in class because you have this medication to try to get your allergies under control. The other thing I used to do is I had to take allergy shots. So I believe it was once every 2 weeks, maybe, all throughout the major allergy seasons, I would get injections. Fortunately, my mother was a nurse, so I didn't have to go to the doctor's office to get that done. But after a while, I just got used to it. It was just a fact of life. Now, a lot of things have developed since that time, thank goodness. And there are many over-the-counter medications that can help to decrease the allergy symptoms. So the number one thing that they tend to do is they tend to just dry you out. So without mentioning any brand names, there's things like loratadine, cetirizine, foxofenadine. All of those are pretty much non-drowsy formulas. So you can take the medications. You are going to feel very sleepy as a result, but they are very effective. And I find that people will try one and say, well, nothing works. Well, oftentimes, if you try one, try a different brand, make sure it's a different generic name as well. See if that one works. Oftentimes, sometimes you even have to mix and match, but before you mix any medications, make sure you speak to your medical professional. Now, there are also nasal steroids that you can use, as well as nasal sprays. So something as simple as nasal saline will help to keep your nostrils moist, and that often helps as far as that dryness that you might experience after taking the oral medications. There are other nasal decongestants also over the counter, along with nasal steroids, which also may work. Now, I will give you a note of warning. If you have high blood pressure, some of the nasal decongestants over the counter can cause your blood pressure to rise. So be very careful. If you have any questions, you can speak to your pharmacist or your primary care physician. There are also other things you can do to help clean out your sinuses, and those are, I can't really mention them without giving a particular brand name, so I'll just say that there are things over the counter that you can find to clean out your nasal passages, and as you do that, you also decrease the inflammation. So that's another route to take. Of course, people say avoidance. Well, it's kind of hard to avoid the spring pollen season. But the other thing that people can try, and this is totally a natural way of doing things that some people do have success with, and that is if you find honey that is made in your area, so locally made honey, because the bees are also local and they have been pollinating the different flowers, sometimes, and it does take a while, just using a little bit of honey on a regular basis causes you to have a desensitization, so to speak, of some of the allergens as far as the pollens in your area. Now, that is not medical advice, that is purely information. But if you don't have any problems with taking honey, you're not a diabetic, it may be something you might want to try. So I hope that that helped you today as I brought you this topic. As I said, most people don't think of this as being an emergency, but just for the fact that it is so annoying. So once again, I am Dr. Leslie, your board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these 2-minute emergencies to help keep you healthy, safe, and out of the emergency department. Until next time, take care, be healthy, and safe. Bye-bye.